This is Cynthia Cisneros. She's had some bad luck. She was born with a condition called Epstein syndrome, a precursor to kidney disease.
Well, I was young. I was like 10 maybe, and that's when they found out that I had this Epstein syndrome, which was going to cause my kidneys to fail. Eventually, we just never knew when, and then until maybe about last year, in the beginning of last year, it kind of just took a toll downwards, like quick.
And with the downward spiral came clear symptoms of kidney disease.
I was so tired, like all the time, and my back hurt so bad because they're in the back. The kidneys are in your backs. And I would go to work and I would just be like, couldn't stand all the time. And I would sleep like till 1 o'clock, 2 o'clock in the afternoon.
At first, Cynthia was able to hold her own, but that didn't last.
They would always tell me my percentage, the level that my kidney was functioning at, and it used to be like, well, they didn't want to do anything until it was like at 20%. Before that, it was just kind of like, oh, we're just going to watch you and keep monitoring you. And it was always like 49, and then 30. And then all of a sudden, like real quick, it hit like 20. And once it hit 20, they were just like, okay, we need to do something because it's going downhill fast.
So the doctors started to talk about the possibility of a transplant, but that presented its own problems.
I had heard that the lists were really long and like a long waiting process and hard to get into, and so we just figured it would be best to test everyone first.
Everyone meant checking all her family members to see if Cynthia had the option of getting a transplant from a living donor. And luckily for Cynthia, her whole family stepped up.
We wanted to test my aunts, my uncles, my brothers, my sisters, my mom, my dad, and they all got tested. And it just happened that my brother was the one that was the perfect match. Everything matched so well. They said on paper we could have been twins because everything was just perfect. The tissue type and the blood type and everything.
So Cynthia turned her bad luck into good luck, thanks to her brother, Anthony.
She just had a kidney disease, and they said it was just going to keep getting worse and worse every day. And it just finally got to a point where she either needed a kidney or she was going to have to pass away. So my parents told me that, and I immediately just jumped on it and was just like, let's see if I can do this, because I knew my parents had already tested themselves out and they weren't eligible for it. So I was like, well, I'm going to try for it. My mom asked me a few times, like, are you sure you want to check this out? And I was like, yeah, let's check it out. It can't hurt anything. And it just happened to be, I was just perfect. Like they said, it was 1 in a million shot of me being as perfect as it was. So it just worked out really good.
Ironically, before the transplant surgery, Anthony and Cynthia were actually not that close and didn't really talk to each other about the possibility of Anthony being a donor for her.
We didn't really sit down and have a conversation about it. I just kind of knew that he would always be willing to do it, and I think it was hard for us to talk about it. Like, we didn't know what to say to each other, but I always knew that he knew that that's what he had to do, and he was willing to do it no matter what.
In the beginning, we really didn't have too much conversation about it, but we kind of spoke more through my mom. She would talk to my mom would talk to me. I don't know, we just never were too intimate to where we could express ourselves like that, but it's changed. Like now we can talk to each other and stuff like that.
So Anthony and his sister learned an early lesson. It helps to have someone else step in and make it happen. And that someone else was their mom.
Yeah, it definitely was big time, because like I said, me and her were never too close to where we expressed ourselves. We would just say I'd go into her room and just wanted to talk to her like that. But so it helped a lot to where my parents could communicate through me and through her, and we were able to, because sometimes me and her, we don't see eye to eye. But I mean, that's anything with any kind of sibling relationship. You don't see eye to eye on most things. So it helped. Our parents were able to help us out, make this a lot smoothly.
If you are a patient with kidney disease, you have two main options.
Well, the options for somebody whose kidneys are failing are dialysis or kidney transplant. So once the kidney function becomes bad enough that the kidneys can no longer support the patient, they will die. And the only options to keep them alive would be to do dialysis or to eventually get a kidney transplant.
The best solution for a kidney patient with end-stage renal disease is a transplant from a living donor. For while dialysis can keep you alive, it is not a cure for kidney disease.
So there are patients who either by choice or because they weren't able to receive a transplant have maintained their health on dialysis for decades. But generally speaking, over time, the percentage of patients who are alive beyond 10 years of dialysis is relatively small, less than 10%.
So it's clear that patients who are on dialysis for a long time face definite health risks.
Well, the people that are on dialysis have a significant risk of dying over an extended period of time. And so if you look at the benefits of kidney transplantation, that by 6 months after you've had a kidney transplantation, you have a lower risk of death than say somebody who remains on dialysis. And that death risk continues for everybody longer on dialysis, and for kidney transplantation, your risk of death has gone down a lot. So that's the advantage for kidney transplantation, is that you really don't, while you're on dialysis is tough on the body. It causes calcification in the blood vessels and those kinds of things. And so, when we look at people that are waiting for kidney transplantation, we see a lot of them that either become too sick to transplant, who die while waiting, or remain on dialysis. But within 5 years, probably only 20% of the people are still candidates for transplantation.
All this leads to one conclusion. It's a good idea for you to try and find a living donor.
The living donor can be related to the recipient, but they don't have to be related to the recipient. So say somebody's spouse could donate. They're not related to the recipient in terms of being of the same blood, but they are related in terms of an emotional relationship. So an emotional relationship is as important as a blood relationship in terms of who gets the kidney transplant.
Well, I think my advice to patients, because it's a very difficult process, if you think about it and put yourself in their seat, you wonder, how am I going to ask somebody for this? This is something that is an incredible gift, and it's hard to understand how I can go about finding out. I usually counsel patients that if they have relationships with friends or family, that to describe sort of the circumstances that they're in, that they qualify for a transplant. However, with the waiting list times being as long as they are, and the fact that their health may deteriorate over time, that in fact living donation provides a better option for them. And rather than asking, will you give me a kidney, explaining their plight and sort of their circumstances, you find out rather quickly whether friends, family, or other individuals might be interested in offering their kidney to them and help them get a better life and a healthier life.
As Cynthia said before, she knew that waiting for a kidney from a deceased donor could take a very long time.
The waiting time now is exceeding 5 to 6 years for most of the patients. And some of these patients may wait substantially longer depending on their blood type, or other factors which make it more difficult to find a compatible donor for them. So some patients may never be able to become a transplant candidate or receive a transplant because of these conditions. And so although they may be on a waiting list, in fact, realistically, they may never receive a transplant.
And the odds for a successful kidney transplant are much higher with a living donor.
In a living donor transplant situation, the kidney is transplanted within a matter of minutes to certainly less than an hour. The donor has been very well screened and is very healthy, and so the immediate function of the kidney is substantially greater. And because of this early quality also leads to increase in longevity of patients undergoing a living donor transplant.
Cynthia was lucky. She had a great family and a perfect match with her brother. But not all kidney patients have it that easy. Finding a living donor can be a challenge, but it can be done.
Well, There's many different ways that people can do that. And one is that, you know, you go to your spouse, your relative, or your friend and say, I'm sick, I need a kidney transplant, and tell them that this is, you know, how the situation works, and see if they're interested to go. Now that obviously is a very difficult question to ask somebody if do they want to donate their kidney to you, and I think it's a hard question, but some people are okay with doing it directly.
As in Cynthia's case, sometimes it helps to use an intermediary to find a possible living donor.
Some people have somebody that might be sort of their advocate go ask their relatives or friends. So if you say had a brother or your wife who couldn't donate because of health or wrong blood type or some other issue, that they could go and ask people for you and just explain to them that, you know, you're sick and, you know, would you think about donating a kidney to Bob because he's, you know, needs a transplant.
And the staff at UCSF can actually help you figure out the best way to approach a possible donor.
One other thing that we will provide is we can write an email for you and give you a sample email, and you could send that email to your friends and use that to ask them, and so that they could respond to the email or just go directly to the website. And that may be easy because then they don't, you know, if they're not interested in donating, they don't have to do anything. And you've asked the question, you sent them an email.
Now suppose you've lined up a possible living donor. The first question they'll ask you is it safe for me to be a donor?
Well, we're very careful about not having anything bad happen to a living donor. So they go through a very detailed screening of their health history, physical exam, and then very detailed testing looking at their overall health as well as kidney-specific health. And then finally some x-rays to determine that their kidneys have proper blood vessels and no other disease that might be picked up by x-ray. Once you pass all those tests and are cleared to donate, the long-term health risks to the potential donor are really very minimal.
UCSF, of course, is one of the leading transplant centers in the country, doing hundreds of transplants every year. So by now, they have a tested strategy for protecting the interests of a living donor.
Using this strategy of very careful workup, very careful follow-up, it appears that the life expectancy and risk for later kidney failure in a potential donor is no different than in the general population.
One of the first health professionals a potential donor will meet at UCSF is someone called the living donor advocate. And that person's sole job is to look out for the interests of the donor and to answer their questions.
A lot of people ask me things like, will I be the same after I donate? Are there things I can not do? Will my life change? Am I too old? Am I too young? Are there other things I need to do to put in place? And one of the most interesting things I get really is, how soon can I do this? You know, I've decided I'm ready to do this. When can I move forward and do this?
While being a living donor mainly benefits the recipient, there are some ways in which the donor can get financial assistance.
The acceptable things are, one is to cover travel expenses, two, to cover subsistence expenses relating to the donation, so covering a hotel room or food or those kinds of things, and then the recipient could cover, say, lost wages, so that if they lost wages in terms of during that time off of work, then that would be, the recipient could do that.
There are also national programs that help cover expenses for a donor.
I have access to a wonderful program called the National Living Donor Assistance Center, and they provide travel-related expenses. So they'll pay for things like flights and travel-related expenses for donors and a loved one to accompany them.
Living donor advocate Sandy Weinberg also has a program where she brings together potential donors with people who have already donated a kidney.
One thing that I'm establishing and have done a little bit on an informal basis is what I call my mentor program, where I have some donors speak to donors who are thinking or potential donors. So people who have been donors will come and speak with other potential donors or people that are considering moving forward but have very specific questions about the process. And every donor that I have matched with another donor says to me, I would talk to anybody about this process, about moving forward, about doing this for my husband, my wife, the person I love, my friend.
Being a living donor is obviously an incredible act of kindness, but there are practical aspects to becoming a donor. How do you get the information you need, and how do you begin the process? At UCSF, it's relatively easy to do that with an online tool called the Breeze system.
So that allows the donor to have a place where they can go and get information about donation and find out whether or not they're likely to be able to be a donor. So that, I think, helps us a lot. And as we talked about before, it's also that the recipients can pass on that website either through an email or through a card to their potential donors, and the donors can go on and do that.
The online Breeze system solves a lot of problems that would-be donors used to have with the older paper system.
In the past, we would have to, give somebody a paper form and have to give them, a booklet, and we give those to the recipient, and they'd go and give them to their friend, but then they need more copies, and we have to get more copies, and so it just wasn't this is a much easier process because it's using the internet and really allowing people to go online from their home and learn about kidney donation rather than trying to get them a brochure in the mail.
If it turns out that a donor is not a good match with a potential kidney patient, that is not the end of the story. There is a national system of kidney exchange, which means that even if you can't directly donate to your loved one, you can start a chain reaction that results in your loved one still getting a kidney. Here's how it works.
We participate in a national kidney registry program in which 80 transplant programs around the country have multiple incompatible pairs. And we enter into this computerized database, and the computer looks for potential compatible donor-recipient pairs. And so many times we perform transplants with the donor being in New York and the recipient here in San Francisco. And that San Francisco patient's donor gives a kidney to somebody in Los Angeles. And so we're using that methodology to try to expand those individuals who really want to give a kidney but can't directly to the recipient.
Some potential donors are put off by the thought that they are not actually giving their kidney to their loved one. But the bottom line of an exchange is that the loved one gets a healthy kidney from a living donor.
Really what you want is your recipient to receive a successful transplant. So although you may not be able to directly give your kidney to that person, you may indirectly allow that person to get a transplant in a way that optimizes the outcome. And that's really what we're trying to accomplish, is not just to perform the transplant, but to have a transplant that's successful for the long run.
So let's get back to the heroes of our story, Cynthia and Anthony. Planning and preparing for the transplant surgery was relatively easy, but when they showed up at the hospital, the emotions started to flow.
Leading up to it, I was not really nervous at all, but I knew once the day came I was going to get nervous, and of course I woke up the morning and I was like, wow, it's really happening today. We were on that drive over there, and I shed a few tears on the way over there just because I was scared a little bit, and then I calmed down, and then once we got into the surgical room I got a little bit more teary-eyed, but it was really nerve-wracking on the day of.
For Cynthia, it was still hard to talk about what was going to happen to her and her brother, but she found a way to do it.
I think it's hard for us to express our feelings face to face, and so when we were saying goodbye, it was I didn't say much because it was hard for me. So I texted him and I just told him thank you so much, I really appreciate it, I love you, and then my mom said that when he was walking down the hall and he read it, he just started crying, and I think it was just easier for me to tell him that way than in person, because I don't think I would be able to handle it, knowing that he was doing so much for me. So
Cynthia was lucky. Thanks to getting a living kidney from her brother, she did not have to wait a long time to get a transplant, and she avoided having to go through the stress of dialysis.
For people that are recipients who are on dialysis, it's a 5 to 7 year waiting time for those people who actually can get there. And it's probably 1 in 5 of the people that are actually listed for kidney transplantation that survive that 5 to 7 years. So of the people that we list for kidney transplantation, if you don't have a living donor, your chances of getting a transplant are relatively low, and that's after 5 to 7 years of a dialysis, which is a difficult life.
Well, as a transplant surgeon and seeing patients who have to go through the long wait to get their deceased donor organs, I'm always quite surprised when the family shows up at the time of transplant and are all wondering why their recipient has gotten so sick and why it's been so hard for them to come through the transplant. And I think if potential donors and recipients really think carefully about the impact on their health of waiting a long time for organs, they'll come to realize that it makes good sense to try and get a transplant done as early in their disease process as possible when they're still in much better health. Because the transplant, if it's successful, which it is most times, will preserve their health at that point and avoid the deterioration that comes as patients have to wait long times for a deceased donor.
Clearly, my message to all the donors is that they're the heroes. Without them, this wouldn't happen, whether it's a living donor or those family members who offer their deceased relatives organs to help people. So clearly, our operation of transplantation is dependent on the generosity and really the beauty of the human spirit and willingness to help people. That being said, we also want to protect those individuals. We want to be sure that gift is used in the best way possible in the recipient, as well as making the process safe. And so for my message to all people considering it is, we will be very careful in your evaluation and be very mindful of your needs and making sure that this process is safe and successful.
And that gets us back finally to Cynthia and Anthony. For Anthony, the living donor for his sister, he says his recovery was quick and he feels as good as new.
By the 3rd week I was good, 4th week, 5th week, I was feeling even better. And then once that 6th week hit, they said I could start playing catch, really running, not super hard, but working my way back into sprinting and hitting and everything like I was able to do. But yeah, after 6 or 7 weeks, I was back to normal, ready for practice. It was good. I was able to play my baseball season. My abilities are the same exact thing. I mean, nothing's affected me. I'm able to eat, drink, anything else I would rather do. Just living a normal life now. So, and she's helped her to live a normal life too. So that's 2 pluses came out of it.
And for the biggest plus, his sister Cynthia, she is back to leading the life of a normal young lady.
Yeah, I feel a lot better now. I have more energy than I have ever had before. And because like before I said, I used to wake up at like 1 or 2 in the afternoon. Now I wake up at like 7 and I don't take any naps throughout the day. Like I am just like all day long, I'm just going, and I've never had that much energy before. So it's like all new to me. So it's a pretty great feeling.
Certainly.
Sure.
Absolutely. Now, I donate blood all the time. It makes me feel really good about myself, and that's a small thing. So I feel like if I gave someone my kidney, I would, not only hopefully be helping them live a longer life, but feeling good at the same time.
So I have a coworker who decided to donate a kidney voluntarily to someone he didn't know because he thought it was a really effective way to help someone in need.
He did a bunch of research on it and found out that it was really safe to donate a kidney. So the risk was about the same as giving birth in the United States, which was pretty surprising to me.
I think it would be best for someone. for just to save someone's life, especially if it's a family or a friend. So I guess as long as it's a match, it would be fine. I'm still going to be alive anyway, so I don't think there should be a problem. There are a lot of people currently living with just one kidney anyway.
But if it's someone who is a good person, maybe. And if I'm in good health. I mean, I'd have to be in good health where I know I can survive on one kidney.
Yeah, I would. I mean, it'd be a big decision, but yes, you got two, give one away, right?
It's not benefits to me, it's benefits to the other person. And when I look at that cost-benefit analysis, right, and what that would take away from me, I don't see that it takes anything from me if I have two fully functioning, capable kidneys, whereas I think it gives value in life to somebody else that would potentially not have that had I not been willing to do so.